Hi everyone. As you must be seeing, our topic for today's discussion will be how we can take care of our child's teeth even before they are born. And now you must be thinking that why? Why is it so important to take care of our child's teeth even before they come into this world? Because, my dear friends, we've seen that dental caries, that is your tooth decay, and periodontal disease, that is your gum and bone related problem, these two have been reported to be the most common bacterial diseases. So, wouldn't it be better if we knew ways of how to prevent it? Now, the purpose of this discussion will be to educate the parents about dental disease and its prevention, because it's very important to educate the parents firsthand so that that awareness is transferred to the child that's going to come in this world. Second is to provide a suitable environment for the child. And third is to strengthen and prepare the child and also the dentition of that child for actually his whole life. And all of this will happen by exclusive prenatal parent counseling. Okay, so prenatal parent counseling, it's basically about counseling the parent, and that parent needs to know how a tooth is formed, because the different stages of tooth formation has also got different implication, and that requires a different video altogether. And if you're interested, do let me know. I shall cover that. Second is when a tooth erupts and its normal eruption timing and the normal variations in its eruption timing. And third, the mother herself should get orally checked, because it has been seen in numerous studies that the high levels of S mutants. S mutants is what? The normal causative, the most common causative agent of tooth decay. So the higher the number of S mutants in the mother, that is a potent high risk factor for the development of tooth decay or dental decay in the coming child. And the very first step in this point of prevention is that a mother herself should keep a good oral hygiene. And we've read before, it's very common, brush twice, brush twice. Yes, brushing twice is very important. But if you can't brush twice, at least brush once before sleeping after you've had your last meal. Why it's important to brush at night? Because when you're brushing at night, you've had your last meal. At night, what happens is the saliva flow reduces. Now, if you don't brush your teeth at night, you just sleep like that, you have all the debris in your mouth. The saliva has reduced, so that means the flushing action, the cleaning action also, the natural cleaning action that was there because of saliva, that also has reduced. And the food debris is already there in your mouth. So it's a perfect environment for the bacteria to work upon the tooth structure and weaken it. But if you brush at night and even floss at night, because flossing actually reaches the area that has not been reached by the toothbrush. Okay, so these two will help and provide a very clean environment, basically no food for the bacteria to work upon, right? On the contrary, I won't say that don't brush. That doesn't mean that don't brush in the morning. Yes, do brush in the morning also. But if you're only able to brush once, then please brush at night. Now, what happens in the morning? You've just brushed your teeth. Ideally, you should not eat anything for another 30 minutes or 45 minutes. But what happens? We just brush and we end up eating breakfast. Okay. So, your whatever substance is there in your toothpaste that has not got enough time to work upon the tooth structure, because some toothpastes have got fluorides and another antimicrobial substances also which fight against the microorganisms. So they don't get that much time. And at night, if you've had your last meal and then you've brushed and you've even flossed, so you've maintained the tooth structure or you've maintained the oral environment, let's say, quite antimicrobial for the entire night. And then the mother herself should get checked. That is, if she needs any scaling because of the deposits that are present, or if there are certain deep deposits which cannot be seen that ways and they are hidden below your gums, then get a deep scaling done, get a filling done. Okay, because if you suppose you have a painless cavitated tooth, okay, you have a cavity in your tooth and it's painless, and you think that just leave it, it's not painful. No, that is the spot wherein your microorganisms are hiding. So you might not have pain, but you have a high amount of the causative agent, that is your S mutant. So we've already read before, right? The higher the number of microorganisms in the mother, higher is the number in the child. So it's very important. Then the third point is the mother should take food that prevents decay. And now you must be wondering that why only mother? Why not father? Yes, the role of father is also important to create and maintain that environment, but the mother is in direct physical contact with the child, and what she does, the child will be the mirror of what mother does. What she takes, what she uses, what does not she use, all of it. So the mother is supposed to take the food that prevents decay. Okay, so what are those food substances? First is your fruit, especially the fruits which have got skin on them. You're supposed to take apples and pears with their skin on them, because that helps in rubbing the tooth surface, cleaning the tooth surface. Then, in the studies, it's also been seen that pomegranate juice, direct consumption of pomegranate juice has shown to reduce the number of S mutants, that is actually the causative agent, largely the causative agent of cavity formation. Then you're supposed to take whole wheat, brown breads, multigrain breads, okay, because they are not that sticky. Then you're supposed to take lots of roughage, butter and cheese. Butter and cheese, these two substances specifically make your tooth surface slippery, and it makes difficult for the bacteria to adhere to the tooth surface. Okay. Now, if a mother is taking those food substances that prevent decay, then obviously she is supposed to avoid those food substances that is sticky in nature and it promotes decay. So all this white bread, biscuit, cupcakes, canned foods, it's got lots and lots of sugar. Soft drinks, they're so carbonated. Again, they cause acidity in your saliva and they cause the leakage or the leach of the minerals. Then your chips, your packaged fruit juices, chocolates, wafers, these are all refined carbohydrates and they're very sticky in nature. So it's difficult for the saliva to remove them by its normal flushing action. And that is why we say that you're supposed to reduce the amount of refined carbohydrates. Then you're supposed to incorporate adjuvants. Now, what are adjuvants? These are basically those substances which will help in prevention or reduction of the microorganisms, or this will help in prevention or reduction of the cavity formation. It's not that the sole use of these substances will help or stop the process of decay. No, but they will help. And the first in this list is topical chlorhexidine. Now, it's really sad to say that the use of chlorhexidine is being used very oftenly and on a very large scale, especially in the urban cities, by people without the prescription of the dentist. It's really sad to see that it's being broadcasted also hugely. That's really wrong, because the regular usage of chlorhexidine for days together has got more side effects than benefits. Okay, and you must be wondering what the term topical is. Topical is nothing but when you're applying something from the top, that is right on the spot. Now, since these chlorhexidine mouthwashes are available, you're rinsing it in your mouth, so there's basically direct application of whatever you're applying to the tooth surface. We call it topical. So you have chlorhexidine mouthwashes that can be used, but that will always be used by the instruction and the supervision of your dentist. Okay. So it helps because this chlorhexidine is antimicrobial, and obviously this will reduce the microbial count in your mouth. But as I've already mentioned, it is just an adjuvant. So when you're doing those previous steps and then with that you're following chlorhexidine usage, then it's going to work even more efficiently. Okay, and then comes the usage of topical fluorides. Now, fluorides are basically certain elements, they stick to the tooth surface, right? And then they make it more resistant to the acid that is being produced by the bacteria. Basically, in simple terms, fluoride, it goes and attaches to the tooth surface and it makes it even difficult for the microorganisms to decay your tooth surface. Simple terms. Okay. So you can use that, but then again that will be customized from patients to patients, and your dentist will decide whether you need it and what amount of it you'll use and what form of it should be given to you, all that. Then there's something called as xylitol, and you have xylitol chewing gums available in the market. Now, this xylitol is nothing but a low calorie sugar substitute, and studies have shown that 6 to 10 grams of its daily consumption 3 times a day has shown to decrease S mutants. Okay, and then another important, and I must say a very important factor, is having an appropriate eating timing. You know what happens is whenever you eat something, your saliva becomes acidic. Okay. Now when it becomes acidic, it takes another 45 minutes for the saliva to become neutral. Now you've had your meal, and within 45 minutes, or let's say within 1 hour, you've taken something else, maybe a slice of bread or just one cookie. So again, your saliva will go back to become acidic. And this regular munching will cause your saliva to remain in that acidic pH for long. And this will cause your tooth structure to weaken. This will cause all the minerals to leach out, and that will eventually cause your tooth structure to become cavitated. And then is the mother should get her morphological defects corrected. Now, what are morphological defects? Basically, any defect in the shape of your tooth structure. So you might not have any cavity, or you might not have any deposits, okay, but the shape of your tooth structure is such that it will help the microorganism to go and hide in there. For example, you might have a deep pit, or you might have a fold. So those folds and those pits will result in the bacteria having a safe niche or a safe hiding spot for them. And if the bacteria gets a hiding spot, we all know that it will help in, again, the decay process. So all of these together, if it's practiced by the mother, she'll have a healthy mouth, and a mother with a healthy mouth will give rise to a child who is having a healthy mouth. So that's it for today, and I hope you found it useful, you found it understandable. This was basically to create awareness between the common man so that they are aware enough to have a healthy mouth of their child. Thank you so much.